Hello, I'm Kim Meredith, CEO of the San Francisco General Hospital Foundation. Our mission at San Francisco General Hospital Foundation is to fund and support patient care and innovation at Zuckerberg San Francisco General Hospital because we believe in health equity and access to care for all. With that in mind, I'm absolutely delighted to welcome Dr. Susan Ehrlich, who is the CEO of ZSFG, and she is a practicing physician there.
Thank you for all that you and your team do to support the work we do at Zuckerberg San Francisco General Hospital. We really couldn't do our work without you. Equity is at the core of the services we provide at ZSFG. When you think about somebody coming to a hospital or to a clinic, people who are housing insecure, people who are food insecure, people who speak many different languages. And the way we approach our care is really different than most traditional healthcare settings. An example recently that I had in clinic with a patient we'll call Mark. So I was in my clinic one day and Mark came in without a scheduled appointment. He needed to be seen urgently for an injured hand. I ended up bringing him into the clinic and asking him about his hand and how he had injured his hand. He told me he had hit a wall. And when I asked him, why did you hit a wall? He said, well, my wife had a sudden heart attack and needed to be brought to the hospital in an ambulance, and she died at the hospital. And I hit a wall because I was so upset and I didn't know what else to do. And in that moment, I knew that he needed a lot more than just treating his injured hand. And I was able to connect him with social services. I was able to connect him with our psychologist. I was able to get him help for he and his small children who were left behind when his wife died. I don't think that kind of care happens in most traditional healthcare settings. And this is what we do, this is what we're proud of, and this is what we're really good at. And this is our special place in the community.
Dr. Neda, Ratanawongsa, Chief Medical Informatics Officer and practicing physician at ZSFG. You were the recipient of telehealth funding from the foundation to create more access for the patients at ZSFG. How does all of that fit into your equity lens and patient care?
So telehealth is one of the ways that we can connect with our patients wherever they are, not just when they come to the hospital, but also when they're at home or in their community, taking care of their children or their loved ones. And it makes it a lot easier for some of our patients to be able to maintain that connection to us. The other great part about this is that we have a whole set of ambassadors who come and help our patients to be able to get on their patient portal. And so one of the most important parts of this is to ensure that our access is available to everyone, no matter what their language or their digital literacy, that everyone can access the care that they need and deserve at our hospital.
Please join me in welcoming Dr. Hemal Kanzaria, an emergency room doctor at Zuckerberg San Francisco General Hospital, who is also medical director of care coordination and a co-founder of social medicine. Hemal, it's wonderful that the foundation could be an early investor in social medicine. And it really raises this question around equity versus equality.
Yeah, I feel really privileged to work in a place that cares deeply about equity and in a place where we meet patients' medical needs and their non-medical needs. And that's the foundation of social medicine, and it's really the foundation of the care we provide at ZSFG across the organization. So Steve came in an ambulance. Unfortunately, he had a fall down a couple BART steps and was primarily complaining of ankle pain. And so we made a plan to treat his pain and to get an x-ray. And unfortunately, the x-ray showed that he had a pretty severe ankle fracture. As I was getting his sort of discharge paperwork together though, I took a moment just to sit again with Steve and learn about how this might impact his life. So it became clear in that conversation that he had been experiencing homelessness. He worked odd jobs to make money, did his own sort of grocery shopping, made his own meals, but you could quickly see how this ankle fracture was going to impact his life and his well-being potentially. So I came out of that room and I felt, again, very privileged that we have an amazing social medicine team. We're able to work closely with our social work partners, with our care coordination nurses, with our pharmacists and our health workers. We had him referred to in-home support services, which offers caregiving support for things like meal prep, grocery shopping, transportation assistance to get to his orthopedic appointment. And so, I mentioned these details because, if it were any of us, and you or myself coming into an emergency department for an ankle fracture, my expectation is that the ED would treat your pain and diagnose your ankle fracture and put a splint on. That's equal care for all of our patients. But we care about equity as well. And so that's meeting our patients, all of their needs. I think that is like the privilege of being at ZSFG, where we can provide exceptional care, high quality care, equitable care for all of our patients.